I'm Dr. Raghu Satyanarayan, consulting physician practicing at Ahmedabad for the past 32 years. Today, I'm going to talk on heart attack. What does heart attack actually mean? Heart attack happens whenever there is total occlusion of the blood vessels which supply the heart, and this leads to damage of the heart muscle. And this is called as a heart attack. There is a total blockage of the arteries which supply the heart, and this can lead to damage to the heart, and they can cause two important things. It can cause a pump failure, and it can cause electrical instability of the heart. Pump failure leading to breathlessness, and electrical instability of the heart can cause sudden cardiac death. Heart attack causes sudden cardiac death also. The reasons for heart attack are hypertension and diabetes, which are the two major risk factors. And if you control your blood pressure and diabetes well, you can prevent a heart attack. The other lifestyle factors which are responsible for heart attack are a strong family history, a very, very strong family history. Age below the age of 50 years, if you have a close first degree relative who has got a heart attack, you are more likely to get the heart attack. Smoking is a very, very dangerous risk factor. Tobacco in any form, whether you are smoking cigarettes, BD, hookah, or in any form of tobacco can be dangerous for your heart. And even if you are chewing tobacco or you are chewing nicotine chewing gums, that also can be risky. People are under the false impression that nicotine chewing gums are safe and they continue to use 8 to 10 nicotine chewing gums during the day. But tobacco in any form can cause a dangerous complication called as a sudden cardiac death. Other risk factor is being overweight or obese. If you are overweight and obese, it can also increase the cholesterol levels in your body. The bad cholesterol is the LDL cholesterol, and it can also contribute to heart attack. So try to maintain an ideal body weight. Unhealthy diet also contributes. Fast foods, highly saturated fats, they can also contribute to high cholesterol values. Lots of dairy products can cause high cholesterol values, and it can cause heart attack. Last but not the least, stress. These days, there are lots of stress among the young individuals to perform. There is always a sense of time urgency among all the younger population. And this is one of the very, very important cause of heart attack. To overcome stress, they resort to tobacco, cigarettes, alcohol abuse, and substance abuse. They are all important causes of heart attack. And now I will tell you something about what are the symptoms of heart attack. Whenever there is a heart attack, a person will develop chest pain in the center of the chest. That is the place where we put on our tie. It is the center of the chest. It is called as the tie area. And the chest pain can be in the form of pressing sensation, heaviness in the chest, or it can be a squeezing sensation. This can radiate to both the arms, and it can also radiate to the neck, and it can also radiate above the neck to the maxilla, but never above the maxilla. And it can also radiate to the upper part of abdomen, but never below the umbilicus. There can be associated symptoms in the form of profuse sweating. Other symptoms are there can be giddiness or dizziness. There can be difficulty in breathing. If it causes a lower inferior wall heart attack, it can cause nausea and vomiting also. So we should know how to prevent a heart attack. To prevent a heart attack, we should take care of all the risk factors which are there, that is hypertension, diabetes, and cholesterol values. And the last thing is to stay away from cigarettes or smoking or tobacco in any form. So you should take care of A, B, and C. A meaning A1C is glycosylated hemoglobin, which is a good control of diabetes. If it is less than 7, you are under goal and you are under control. B is for blood pressure. So if your blood pressures are below 140/90, you are under goal and you are under control. And the C is for cholesterol. That is the bad cholesterol is called as LDL cholesterol. That should be less than 70. So if you take care of your A, B, and C, you can definitely prevent a heart attack. The last thing is stay away from cigarettes or tobacco in any form. Treating blood cholesterol and by taking statins are very good. And please don't meddle with the doses of your statins or your antihypertensive drugs or your anti-diabetic drugs. There are some modification in your diet. You can take a Mediterranean diet. A Mediterranean diet is, the people in the Mediterranean area don't get heart attacks because they indulge in lots of fruits and vegetables. They also eat nuts and vegetable oils and olive oil in the Mediterranean region. So Mediterranean diet is a very, very good diet, but please try to avoid saturated fat diet. That is cheese, dairy desserts, fat meats, and also you should not be taking highly processed foods. We should also take care of your exercise. Please do regular exercise. 150 minutes per week is the recommendation. 30 minutes per day and 5 days in a week, you should be doing a brisk walk. Brisk walk meaning 3 kilometers in 30 minutes. 10 minutes and 1 kilometer should be the goal. So if you're walking for 30 minutes every day and 3 kilometers, the purpose is served. Or you can also do high intensity exercises for 75 minutes per day in the form of jogging every day for 75 minutes per week is good enough. Last but not the least, I would also suggest everyone to take care of the stress values by doing yoga, relaxation techniques, and meditation. This goes a long way. I think if you take care of your stress, I think you can definitely prevent a heart attack. Follow lifestyle measures and follow doctor's advice. And please don't meddle with the doses. And please stay under control by controlling A, B, and C and staying away from smoking. Thank you.